By a show of hands, how many of you have heard of the fentanyl crisis, which is killing people in record numbers? How many of you know someone dealing with opioid addiction or have lost a friend or loved one to the fentanyl crisis? Do you think that there is enough awareness about the fentanyl crisis? Do you think that we are doing enough to help end the fentanyl crisis? The need to overcome the epidemic of the fentanyl crisis cannot be overemphasized because it has impacted many homes in negative ways. So many families have lost their loved ones. So many parents have buried their children. A recent heartbreaking example of a fentanyl poisoning-related death occurred when Mariah Rachel Earp, who was a mother of 3 young children, died at the age of 27 in 2020 after taking what she thought was Xanax. We acknowledge all those who we have lost to the fentanyl crisis. Mariah Rachel Earp was one of the victims of the fatal fentanyl crisis. Her children lost their mother. Her parents lost their child. This is just one story of the many American families who have lost their loved ones to the fentanyl crisis. How much longer will this mourning over fentanyl-related deaths last in the United States? The heartbreaking and alarming death rates of the fentanyl crisis is the reason for my passion about this topic, and this speech will help raise much-needed awareness and suggest solutions. The fentanyl crisis is a national epidemic. According to the CDC, over 150 people die every day from overdoses related to synthetic opioids like fentanyl. According to the National Institute on Drug Abuse, in 2021, there were 70,601 fentanyl-related overdose deaths. According to WRDW, the Georgia Department of Public Health reported that fentanyl was Augusta-Richmond County's #1 killer of adults between the ages of 30 to 50 years old. It is such an epidemic in Augusta that it's difficult to find a street drug that is not laced with fentanyl. According to the CDC, fentanyl overdose rates were 2.5 times higher for males than females. Fentanyl overdose death rates were highest among those between the ages of 25 to 44. This graph shows that fentanyl deaths have increased every year since 2012. The fentanyl crisis has its origin in the opioid epidemic. Prescription opioids such as oxycodone, promoted by Purdue Pharma, led to opioid addiction in many people. Those addicted to opioids may use drugs such as heroin, which may be laced with fentanyl. According to the CDC, there are 2 types of fentanyl: pharmaceutical fentanyl and illegally made fentanyl. Pharmaceutical fentanyl is prescribed by doctors to treat severe pain. However, most recent cases of fentanyl overdose deaths are linked to illegally made fentanyl, which is often added to drugs. It is very clear that the fentanyl crisis is devastating because it has led to the death of thousands of Americans. Therefore, there should not be any delay in interventions to help end the fentanyl crisis. I greatly appreciate all efforts to end the fentanyl crisis so far. Here are my suggested solutions to add on. In order to decrease the amount of fentanyl entering the United States, the government should provide resources for the U.S. Department of Homeland Security to invest in scanning technologies at ports of entry. Raising awareness about the fentanyl crisis is important because many people are unaware that fentanyl is being added to drugs. For this reason, I will advocate through the congressman and senator that the government should sponsor television advertisements, which would warn Americans about the dangers of fentanyl-laced drugs and raise awareness about SAMHSA-supported substance abuse treatment centers, which use a combination of medications such as methadone, Suboxone, and naltrexone, behavioral therapy, and counseling services to treat opioid addiction. We should raise awareness about the fentanyl crisis to others. These advertisements would also include information about resources for those dealing with opioid addiction, such as SAMHSA's National Helpline, which can be reached at the following number: 1-800-662-HELP. We should also raise awareness about the fentanyl crisis on billboards, such as those of Mariah Rachel Earp, social media, news outlets, churches, recreational centers, and radio stations. Addressing substance abuse is important because fentanyl is often added to drugs. For this reason, I will also advocate that housing and jobs be provided to the youth on the street who often engage in illicit drug use. Recruiting more mentors in the community and building more recreational centers will help in supporting youth development and decrease illicit drug use. Because fentanyl overdoses are driven by a wave of teenagers and young adults taking pills such as Percocet, oxycodone, and Xanax, which may be laced with fentanyl, awareness should be raised about these dangers in schools. Students should be taught about the importance of only taking prescribed medications and avoidance of street drugs to decrease their risk of fentanyl overdose. We need to expand access to fentanyl test strips, which detect the presence of fentanyl in different kinds of drugs. In order to increase the availability of fentanyl test strips, support should be provided for pharmacies and substance abuse treatment centers to obtain them. In order to increase the availability, ideas should be implemented such as those in Ohio, where no-cost fentanyl test strips are being offered. These ideas should be implemented in Georgia and across the United States. Everyone listening can help end the fentanyl crisis. If you or someone you know is at risk for an opioid overdose, you should carry naloxone, which is a medication that can reverse an opioid overdose, and store it at home based on CDC recommendations. You can write to your senators and congressmen about the fentanyl crisis. You can raise awareness about the fentanyl crisis to others and on social media. There is an urgent need to end the fentanyl crisis because it is killing people in record numbers across the United States. We need to work together to create and implement meaningful solutions to prevent tragic overdose death stories, such as those of Mariah Rachel Earp. The way to get started is to quit talking and begin doing. Hopefully, we will soon have a nation where families do not have to bury their loved ones due to the fentanyl crisis. God bless us all. God bless America. Thank you.